The role of nutrition therapy in healthcare. Role of the registered dietitian nutritionist in the healthcare system. Our learning objectives describe the 3 categories of the scope of practice developed by the Academy of Nutrition and Dietetics. Differentiate between the 4 clinical nutrition team members. Identify other health professionals that are a part of the interprofessional team. Explain why nutrition services are expected to expand under the Affordable Care Act. Describe the 5 components of critical thinking and their applications in providing nutrition care. Define evidence-based practice and its relevance. The practice of clinical nutrition is called nutrition therapy. Registered dietitian nutritionists, or you can hear me say RDNs, are the educated and trained professionals who can best deliver nutrition therapy by using the nutrition care process. The nutrition care process consists of 4 major components: nutrition assessment, nutrition diagnosis, nutrition intervention, nutrition monitoring, and evaluation. The scope of practice was developed by the Academy of Nutrition and Dietetics and focuses on food, nutrition, and dietetics, as well as related services. Please review Figure 1.1 on page 4. The scope of practice is divided into 3 categories, and all 3 are supported by the education and credentials you are now in the process of obtaining. The first area is foundational. That defines the roles, functions, responsibilities, and activities that dietetic practitioners are educated and authorized and proficient to perform within the boundaries of federal, state, and facility regulations. Practice standards are used to evaluate a dietitian's job performance. The second area is management and advancement. Provides tools, guides, and information to help the RDN determine whether she or he has the necessary knowledge and skills to take on a new job responsibility within her or his scope of practice. The third area of practice is resources. Includes materials available to help the practitioner provide current, safe, ethical, and high-quality food nutrition services. Remember, the scope of practice is meant to be flexible so that as the profession changes or as an individual specializes or advances in his or her practices, evaluation resources and decision aids will also be modified. Review box 1.1 on page 5. This discusses and scope of practice for the profession of nutrition and dietetics. The revised 2017 scope of practice for the RDN reflects the position of the Academy on the essential role of the RDN in the direction and delivery of food and nutrition services. The scope of practice for the RDN is composed of education and credentialing, practice resources, Academy standards of practice and professional performance, code of ethics, accreditation standards, state and federal regulations, national guidelines, and organizational policy and procedures. The revised 2017 scope of practice for the RDN is used in conjunction with the revised 2000 standards of practice, SOP, in nutrition care, and the standards of professional performance, the SOPP, for RDNs. The SOP addresses activity related to direct patient and client care. The SOPP address behaviors related to professional role of RDNs. These standards reflect the minimum competent level of nutrition and dietetic practice and professional performance for RDNs. A companion document addresses the scope of practice for the NDTR. Academy documents, along with applicable state and federal regulations, state practice acts, accreditation standards, organizational program policies, guidelines, and national practice informed standards serve as guides for ensuring safe, ethical, culturally competent, patient or person-centered quality nutrition and dietetic practices. Uses may include any of the following: guide career advancement, assist in self-evaluation, develop position descriptions, contribute to hiring decision, initiate regulatory reform, or determine whether a specific activity aligns with the practitioner's individual scope of practice, such as ordering privileges. RDNs lead people to achieve a common goal by setting a direction, aligning people, motivating, and inspiring, provide overall direction for areas of responsibility that reflect strategic thinking and planning to align with mission, vision, and principles of the organization to achieve desired outcomes, identify needs and wants of customers to direct and design the delivery of customer-centered services in line with an organization's mission and expectations, ensuring the employee workforce is engaged in the vision for services through training, mentoring, opportunities to give input with clear expectation for performance and accountability. RDN serves on all levels of management: consultant, supervisor, manager, unit manager, director, service director, administrator, vice president, president, chief operation officer, executive officer, and owner. Practice settings for RDNs include healthcare organizations, schools, colleges and universities, businesses, and corporate settings such as food distribution, group purchasing, health and wellness coaching, nonprofit organizations, association management, population health, and government agencies. Responsibilities range from managing a unit, department, and a multi-department to system-wide operations in multiple facilities. Credentialing. RDN is the national credential granted to individuals who meet the education and other qualifications established by ASCEN and CDR. ASCEN is the accrediting agency for dietetic education programs of the Academy and is recognized by the U.S. Department of Education as the accrediting agency for education programs that prepare RDNs. CDR is the credentialing agency of the Academy for all RDNs and NDTRs and is fully accredited by the National Commission for Certifying Agencies, the accrediting arm of the Institute for Credentialing Excellence. Accreditation by the Institute for Credentialing Excellence reflects achievement of the highest standards of professional credentialing. The Commission of Dietetic Registration, or CDR, has moved to change the entry-level registration eligibility education requirement for dietitians beginning in 2024 from a baccalaureate degree to a minimum of a graduate degree. A graduate degree includes a master's degree, practice doctorate, or a doctoral degree. The clinical nutrition team. Healthcare is defined as the prevention, treatment, or management of illness. Registered dietitian nutritionists are employed in a number of acute and chronic health care facilities to include hospitals, clinics, skilled nursing facilities, long-term acute care hospitals, residential or assisted living, continuing care retirement communities, rehab, adult daycare, hospice. Depending on this institution, nutrition therapy services may be organized along different lines. The manager of the services may have a title of Chief Clinical Manager or Clinical Nutrition Manager. This person often reports to the Director of Nutrition Services, who commonly supervises the Clinical Nutrition Manager and Food Service Manager or Director. Other important personnel in nutrition therapy services are Registered Nutrition Dietetic Technicians, or NDTRSs, who assist dietitians in nutritional screenings of patients and provide provision of nutrition education in addition to other duties. And you have the dietary assistant / diet clerk, who often is responsible for the documentation and processing of diet orders and assuring accuracy of the meals that are provided for patients. So the types of acute and chronic healthcare facilities in the United States: you have the public not-for-profit, often owned and managed by the county or state government; private not-for-profit, owned or managed by the community, a religious organization, district health councils, or their own hospital board; private for-profit. This is an investor-owned for-profit healthcare organization. You have veterans and military. This is government-run healthcare facilities for veterans of the U.S. military service and active duty enlisted men and women. Also, you have outpatient. This is for preventive or primary healthcare, such as treatment for an ear infection, and secondary healthcare, such as treatment for type 2 diabetes, or urgent care, provides primary care. Skilled nursing facilities provide 24 hours a day, 7 days a week nursing care for complex medical needs. You have long-term acute care hospitals, provides care for those with complex medical needs who have a longer than average hospital admission. Residential assisted living provide for activities of daily living, such as bathing or getting dressed. And then you have the continuing care retirement community. So this provides a continuum of care from independent living, assisted living, and skilled nursing on one geographical site. You have rehabilitation. This provides integrated multidisciplinary assistance for recovery from an acute or chronic illness or surgical procedure, such as if a person had a stroke. Adult daycare facilities often supervision. The facilities offer supervision, social and recreational activities, meals, snacks. It provides daily respite for family members, maybe if a person has dementia. Hospice, focusing on relieving symptoms and supporting those with a life expectancy of 6 months or less. So let's talk about responsibilities and tasks of the clinical nutrition team. So when you think about the clinical nutrition team, it starts with the clinical nutrition manager. So this person directs the activities of the RDNs under that, him or her, the NDTR, and the dietetic assistants. The clinical manager is known for hiring, evaluating, and training employees. They have to write the job description, schedule employees when they're going to work, develop policies and procedures, design performance standards, and developing and implementing goals and objectives for their department. Then you have the registered dietitian, provides nutritional care for patients. The dietitian could be doing nutritional screenings or assessments of patients to determine the presence or risk of developing a nutrition-related problem, development of nutritional diagnosis, interventions, and monitoring and evaluation of the nutrition care plan. The next member of the team would be the dietetic technician, or we would say NDTR. Responsibility includes assist the clinical dietitian. The DTR, or the NDTR, gathers data from nutritional screenings, assigning a level of risk for malnutrition according to the predetermined criteria, administering nourishment and dietary supplements for patients, and monitoring tolerance, and providing information to help patients select menus and give sample diet educations. A dietetic assistant, or the diet clerk. Responsibilities include assist the clinical dietitian and the dietetic technician in some routine aspects of nutritional care. Processing the diet order would be a major responsibility of your diet clerk. Checking menus against standards, setting up standard nourishment tallying special food requests, distributing and collecting patient menus and trays, may be involved in evaluating patient food satisfaction and helping to gather food records used to evaluate nutrient intake. So everyone works as part of the team. This is your team for your clinical nutrition team members. So that would include the clinical manager, the registered dietitian, the dietetic technician, the dietetic assistant / diet clerk. Other health professionals, or your interdisciplinary team. In the healthcare setting, individuals from different disciplines communicate with each other regularly in order to best care for their patients. Dietitians are integral members of the patient healthcare team and collaborate with physicians, pharmacists, nurses, respiratory therapists, speech pathologists, occupational therapists, social workers to provide nutritional treatment for the patient. So the chart will break down the education and certification requirements for selected members of the healthcare team, but I'm just going to talk about each member of this team. Let's start with the physician. The practice of medicine by physicians includes the diagnosis, treatment, correction, or prescription for human disease, ailment, injury, infirmity, deformity, pain, or other condition Physical or mental. All physicians in the United States have advanced training and certification in specialized areas of medicine. Physician assistants diagnose illness, develop and manage treatment plans, prescribe medication, and often serve as a patient's principal healthcare provider. Physician assistants have to be supervised by a physician. Next, the nurse. The largest group of healthcare workers in the United States is nurses. Registered nurses assist in the treatment of patients, administer medication and intravenous solutions, education to patients on various medical conditions, and provide advice, follow-up care, and emotional support for patients' family members. Since nurses provide care 24 hours, 7 days a week, nurses are commonly responsible for the initial nutrition screening of patients and then documenting a patient's food intake during hospitalization, as well as notifying the dietitian if a patient's intake is inadequate. Nurse practitioners have specialized training that allow for a higher level of patient care, such as prescribing medication. The pharmacist. A licensed pharmacist dispenses medication and advises the medical staff on the selection and effect of drugs. Also, pharmacists monitor lab results for therapeutic drug levels, as well as electrolyte levels for patients receiving parenteral nutrition, and review risks for drug and drug interactions and drug and nutrient interactions. Occupational therapist. Evaluate and provide intervention in collaboration with the client, family, caregiver, develop, improve, sustain, or restore skills and activities of daily living, or you might hear them say ADL, work on productive activities for play or leisure. OTs often work with patients with swallowing disorders and clients with physical disabilities to provide special instructions on eating and using of adaptive feeding devices. Physical therapists help patients reduce pain and improve or restore mobility, teach patients how to prevent or manage their conditions so that they will achieve long-term health benefits. They also work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyle. Respiratory therapist provides testing, treatment, and care to patients who have difficulty breathing caused by cardiopulmonary disorders such as heart failure or pulmonary hypertension and other medical emergencies. Speech-language pathologists, sometimes called speech therapists, assess, diagnose, treat, and help to prevent speech, language, and cognitive communication, voice, swallowing, fluency, and other related disorders. Speech, language, and pathologists working in healthcare centers provide clinical services to individuals with swallowing disorders, and they work closely with dietitians to help assess the need for and to provide nutrition support. Social workers. Social workers work with individuals and families to provide the psychosocial support needed to cope with chronic, acute, or terminal illnesses. They also educate family members, counsel patients, and help plan for patients' needs after discharge by arranging community and financial resources to cover medical needs, food-related services, and costs. Healthcare services and reimbursement for medical nutrition therapy, or MNT. Where do nutrition services fit within our current healthcare picture? Nutrition therapy remains as an essential component of medical treatments, and research indicates its importance will continue to be recognized. The provision of nutrition therapy and its reimbursement are affected by healthcare financing. The pluralistic system of healthcare used in the U.S. includes many components such as private insurance, group insurance, Medicare, Medicaid, workers' compensation, the Veteran Health Administration medical care system, Department of Defense hospitals, clinics, the Public Health Service, Indian Health Service, state and local public health programs, and the Department of Justice Federal Bureau of Prisons. The system is structured around the provision of health insurance. Health insurance. So 64% for private insurance, 64% of insurance population is under the age of 65. Public insurance, 33% of the insurance population under the age of 65. Many Americans were forced to live without health health insurance before no one could really afford this. So we want to discuss reimbursement for nutrition therapy services. Reimbursement for nutrition therapy services. January 1st, 2015, the Centers for Medicare and Medicaid Services will now pay for intensive behavior therapy for obesity for Medicare Part B beneficiaries as group service, in addition to the existing coverage for individual services. So differences in coverage for nutrition services vary by region and insurance. So the Academy offers a program called, it is called Power of Payment. The Power of Payment program is a free program through the Academy. You can start as a student with this program. They want you to understand the basic of healthcare payments and other services of funding for the services you as a future dietitian will provide no matter where you work. When you understand where the money comes from, you're better positioned to negotiate salary and secure the future of your profession. So as a student, you can enroll in this free program. If you look on Moodle, I have attached the link about talking about getting paid, but every insurance company will pay you something different based on that, your contract that you would have with the insurance company as the dietitian. So a dietitian in one region will probably get paid differently than a dietitian in a different region. So let's talk about public insurance for reimbursement. Medicare. Medicare pays RDN to enroll in the Medicare program as providers. Providers are able to bill Medicare for MNT services provided to Medicare beneficiaries for type 1 diabetes, type 2 diabetes, gestational diabetes education, non-dialysis kidney disease, and post-kidney transplant status, and more recently, intensive behavior therapy for obesity. Medicaid. Some states include benefits for nutritional services, but there is significant variability among states. Every state will be different when it comes to your Medicaid population. The Affordable Care Act, enacted under President Barack Obama, extended the availability of health insurance to all Americans in 2014. By 2015, the uninsured rate was down to 9.1%. The Affordable Act allows individuals and small businesses to compare and purchase health plans similarly to those traditionally provided by larger companies. Nutrition services expanded since the Affordable Care Act requires preventive services such as counseling regarding obesity, weight loss, healthy diet, and exercise, and behavior counseling for adults with like hyperlipidemia or other known risk factors for cardiovascular or chronic diet-related disease. Clinical skills and professional performance. The 2017 National Cancer Institute defined medical nutrition therapy as treatment based on nutrition. It includes assessment of a person's nutrition status and giving the appropriate foods or nutrients to treat conditions such as those caused by diabetes, heart disease, and cancer. RDNs are educated and trained professionals and are the members of the healthcare team best able to deliver accurate and appropriate clinical judgment in order to provide appropriate nutrition care. Completing the didactic program in dietetics with a bachelor's degree is your first step in becoming an RDN. The next step, supervised practice, provides the opportunity for a dietetic intern to apply his or her education in the clinical setting. Critical thinking. Critical thinking is the act of thinking, using the mind to organize and integrate information, identify relationships, and make inferences, form conclusions, and make decisions. As a dietetic student, you will be required a great deal of knowledge during your dietetic education. You will require a great deal of knowledge during your dietetic education. Students usually do not have the opportunity to apply that knowledge other than hypothetical disease case studies or simulations. Once a student becomes a dietetic intern, she or he quickly finds out that providing nutrition care requires more than mastery of a textbook. To provide optimal nutritional care, many aspects of a patient's life must be considered. Thus, the path to becoming an RDN requires both education and practice. Specific knowledge base. Nutrition and its role in health and disease is the primary foundational knowledge required to practice as an RDN. The dietitian's knowledge base also continuously changing and expanding. Learning is a lifelong process, and dietitians engage in continuing education throughout their career. Nutrition is a developing science, and as new information becomes available, dietitians must apply the new developments to practice. Experience. Dietitians do not learn from textbooks alone. They also learn by observing, listening to patients, interacting with other healthcare professionals, reading patients' medical charts, and reflecting on the situation that arise. Dietitians are required to complete a supervised practice experience, a dietetic internship, a coordinated program, or individualized supervised practice pathway before they're eligible to write the exam for registration. This period of supervised practice allows the student to gain experience in all areas of dietetic practice. Real patients with real problems provide the most effective learning experience by stimulating the dietetic intern's intellectual curiosity and promoting retention of the information. Medical problem solving and evidence-based dietetic practice. In addition to having knowledge and skills related to nutritional care, you must also have the ability to identify nutrition-related problems and make decisions regarding the most appropriate nutrition-related solutions. Read page 12 as an example. As defined by Ann, evidence-based dietetic practice is the incorporation of systematically reviewed scientific evidence into food and nutrition practice decisions. It integrates professional expertise and judgment with client, customer, and community values, and evaluates outcomes. Changes in nutrition therapy recommendations are inevitable because of new developments in science and medicine, including ongoing research in nutrition therapy, and has been instrumental in developing the evidence-based guidelines, which are posted online for its members. As defined by Ann, a guideline is a systematically developed statement based on scientific evidence to assist practitioner and patient decisions about appropriate health care for specific clinical circumstances. Guidelines are tied to the evidence-based library, which is updated to dietetics, and it is rapidly becoming the standards for all healthcare professionals. RDNs use evidence-based practice guidelines from other healthcare professionals to provide optimal level of healthcare for their clients. Problem solving and decision making. The process of problem solving involves obtaining information about the problem and then using the information to effectively solve the problem. To determine a patient's nutritional problem, a practitioner can assume that there is a problem when the patient's nutritional status is not optimal. The patient's nutrition-related information is also collected in order to find clues that point to the nutrition diagnosis and solution. Making a decision involves making a choice. The activities in decision-making include the following: identify and define a problem or situation, assess all options for solving the problem, weigh each option against a set of criteria, test possible options, consider the consequences of the decision, make a final decision. The activities do not necessarily take place in a particular sequence. The clinician is usually moving back and forth and considering things simultaneously. The outcome of this process is a decision that is informed and supported by evidence and reasoning. Diagnostic reasoning is defined as a series of clinical judgment that result in an informal judgment or formal diagnosis. Physicians are responsible for making a patient's medical diagnosis. However, dietitians continuously use the process of diagnostic reasoning to determine the nutrition diagnosis and monitor a patient's progress and or response to nutrition therapy. Attitudes and standards. Attitudes reflect the dietitian's values and should ensure that clinical judgment is made fairly and responsibly. Dietitian's attitude includes integrity, thinking independently, and risk-taking. Professional standards include ethical standards, criteria-based evaluations of outcomes, and standards for professional performance. Ann's Code of Ethics and Standards of Professional Performance both require measurable evidence-based evaluation of outcomes. While the standards of professional performance are broader statements to help guide the practice of dietetics, they do require that dietitians continuously improve their knowledge and skills, that they regularly evaluate the quality of their practice, revisiting it if necessary. An important link among the nutrition care process, the standards of professional performance, and the Code of Ethics is that outcome research may be a consequence of regular evaluation of practice quality. Levels of clinical reasoning. When a dietetic student completes the required supervised practice and then passes the registered exam for dietitians, she or he is considered to have entry-level competence. As the new dietitian develops professionally and moves beyond entry level, she or he becomes more proficient and develops expertise in her or his area of practice. For entry-level dietitians, skills may be at a basic level. The dietitian has only limited experience and may rely on the facts and sets of rules or principles to make decisions. As the dietitian becomes more experienced, she or he begins to examine alternatives independently and systematically, disconnecting from the authorities. The dietitian is better prepared to anticipate possible outcomes and identify a broader range of options. The highest level of clinical practice involves an analysis of the entire situation, the person, the illness, the meaning of illness to that person, and the person's lifestyle, the family needs, the social influences, the physical environment in which the person lives. At this level, the dietitian is acting in support of the patient, the principles of the nutrition care process, and the professional standards that underlie the discipline of dietetics. During this class of medical nutrition therapy course, you will be required to complete assignments that will help you apply much of the information presented in this text.